Be seated, everyone, as we proceed. A very warm welcome back to everyone. I hope you all enjoyed the refreshments and had a moment to relax. We now continue with the second part of today's program. To begin, it is my pleasure to invite a very respected member of our university, Dr. Raghuram Achar, Dean of Student Welfare, to address the students. Sir will be speaking about student-centric facilities at Mahayogi Gorakhnath University and guide our new batch on how to make the most of the support and opportunities. Sir, we warmly invite you to the stage. Please.
Thank you. Respected dignitaries, deans, colleagues, faculty members, proud parents, and my dear students, warm welcome to you. It gives me immense pleasure to address you today at this gathering, the white coat ceremony, the foundation course inaugural program. A lot of things have been already said regarding the student-centric facilities. The leadership from the front has been instrumental in ensuring that students are given the prime importance, and it is the students who lead the university, and rightly said by both Vice Chancellor sir and Registrar sir that you are all the brand ambassadors of MGUG. Today is not just the beginning of your MBBS journey, as rightly mentioned by Dean of Medical Sciences. You are creating history here, especially because you are the second batch. At the same time, you are the first batch of students who are of 150 strength. So that's again a historic event which is happening here at the Faculty of Medical Sciences. Your entry marks a new chapter in the growth of Mahayogi Gorakhnath University. And as you grow, even MGUG is growing. So that's a good thing for you. If you ponder upon what is going to be in store for future, there's a lot of things to be in future for you. There's a well set auditorium which is here established for you, and you can imagine that in the coming years you will make the best use of all the opportunities which have been laid out in this campus. MGUG, talking about MGUG, it's a young, dynamic university, vibrant with new ideas and guided by ancient wisdom. We are fortunate to have the leadership in the form of Honorable Chief Minister of Uttar Pradesh, Yogi Adityanath Ji Maharaj, who is leading from the front, whose vision has been instrumental in establishing this great institution. And we are ably supported by our Honorable Vice Chancellor, Dr. Surinder Singh sir, and Dr. Pradeep Kumar Rao sir, Registrar sir, whose encouragement ensures that every initiative here revolves around the growth and welfare of our students. And it is in the very first session that they have already mentioned that you can knock their doors anytime as students. So they have a clear vision set for you that anything for which they have to help you out and cater to your needs, we are always there. And here at MGUG, we cater your needs, academic or your extracurricular, co-curricular activities. We are here for you. And join hands in ensuring that we develop a conducive environment where there is a lot to unfold in future. And talking about the academic support and the faculty, we have faculty members who are from different parts of the country with vast experience in teaching, research, clinical exposure and mentorship. They are here not just to teach, but to guide, motivate, and walk beside you throughout this journey. So that's a very important thing. And it's not like any other medical college. It's a university, and you are under a university where there are a lot of other faculties as well. So what does this mean? This provides you an interdisciplinary approach, a multidisciplinary approach as well, where not just medical sciences is there, you have Ayurveda as well. You might have heard a lot about the integrated medical education system which is being established in the country. And with that, you have nursing and paramedical, we have the pharmacy, we have agriculture, we have life sciences, we have commerce. So there are a lot of other programs which are running, academic programs which are running, and this gives a different environment altogether, where you can grow in a fashion where you understand what is happening in other faculties as well. For example, a conference is happening in Ayurveda. Now we have a conference which will be there in 16th, 17th, and 18th, and we have been fortunate enough to have center which is established, which is being established at Ayurveda College. That is the Center for Traditional Medicine. So there will be a lot of things in store. You can also experience that. It's not that you have to go somewhere else, 50 kilometers, 100 kilometers, or 1,000 way to experience. So this is what happens with a multidisciplinary university like what we have at MGUG. So this integration enables a broader understanding of health and life sciences, thereby nurturing the doctors who think beyond the silos and embrace holistic learning. So, and as rightly mentioned by our Vice Chancellor, that you know that there are two hospitals, and this special, the serene location which we are in is actually named as Arogya Dham by Honorable Yogi Adityanath Ji Maharaj. So you can see that there is a lot of aspiration towards providing better health facility. So there is a rural setup here. There are a lot of people who come from in and around places, also from Bihar, because as we were at the medical hospital, we saw that there are a lot of people who come with the name that we are going to Mahayogi Gorakhnath Hospital to get the treatment done. So you have a great exposure over there as well. And the campus is serene, it is very secure and student friendly as well. And rightly, sir was mentioning that you will be feeling away from home, but let's call it as home away from home. So you have hospitals, you have hostels, 24 hours, medical support is also there. So there are a lot of opportunities laid out to ensure that you don't feel left out, right? And the environment is designed in such a manner that you learn, reflect, and thrive. So, and MGUG is also taking utmost responsibility and utmost care in ensuring that the world-class facility of laboratories or the library or whatever facilities you are about to get is very well planned. So this is what I can like assure you, because only one such incident when equipment for a laboratory was to be purchased, uh, there was no mediocre decision. There was a very core decision from the leadership that the best of the best facilities should be provided for the students, and the leadership is taking so the leadership is taking the care, sure that the best. Yeah. And talking about how ready we are in terms of academic and research support, recently we had a FDP program where the faculty have already been trained to use the AI technologies in teaching and learning and assessment. So that's the way in which, and now with student council also coming up, we have student representatives from all the faculties, so you can interact students, the representatives from different faculty. So that will create an exposure for you to create clubs, societies among the student population. And soon we'll be having a student-led research journal as well, digital journal which we call. The leadership is all prepared to ensure that we have such initiatives in coming days. And talking about platforms like NSS and NCC, it's a very big uh, setup which we have, and a very good support which is laid out in form of NSS and NCC. all the students can get the benefit out of it. And also, I would like to specially mention that medical education is one thing, and also you have a lot of support for research. So think about it as well. Well, in the due course of time, in the future days and future years, you'll have opportunity to apply for ICMR student research fellowships. We call it as ST, a short-term studentship. Paid internships are there. So you have the opportunity to undergo such research programs. So most welcome to discuss with all the faculty members, the doctors whom we have, that you can take up such research programs. And any special training and special workshop which has to be done in ensuring that you gain expertise apart from the regular the core domain, like be it in AI or the Dean Academics is very much interested in ensuring that your needs of being like the society ready and the present day technology ready and technology driven initiatives are already in place, and we'll have them in sometime to sometime soon in the university. And at the same time, whatever I had to cover has already been covered by the leadership. Nowhere in India, I think students would have been given the opportunity to address the gathering or take a role of anchor or a comparing role during a president's program. That was very interesting to see, and the students delivered it appropriately. You can see that on the YouTube as well. And we have a very good engaging IT team as well, with wonderful Wi-Fi facility, which is again gearing up for the next version of it as well, with 1 Gbps line. So there is a lot of things in store. YouTube is very active. Our social media is very active. Our university-led magazines are very active. So you can all participate in those activities and make the best. When I was given the when I was given the topic of student-centric facilities, the very apt shloka came into my mind, which always keeps on keeps me wondering. Acharya Padamadate Padam Shishya Padam Shishya Swamedhya Padam Sabrahmacharibhya Padam Kalakramena cha. What does this mean? A student acquires knowledge, one quarter of it by the teacher. From the teacher, you acquire only 1/4 of your knowledge, but 1/4 of it with self efforts, and the other 1/4 is with the peers, your community, your student, your friends, and your seniors will teach you, and the remaining quarter will be from the time. With time, you'll learn a lot. So you are in the 0th time now, as per the physics. You have 5.5 years of time. So you have a lot of things to learn, and we are here to cater your needs. So the timeless wisdom of this particular shloka reminds that the true learning is continuous, collaborative, and self-driven. And MGUG provides the environment to make it possible. So with that, I end my address over here. As you begin this wonderful journey, you are not just part of MGUG's history, you are helping to write the history of MGUG. So the university will grow through your achievements. Do remember this. So as it is student centric, the university has a lot of confidence and courage to ensure that students lead this university. Your compassion and your commitment is very much required. So let us together build a culture where every student feels supported, every talent is recognized, and every dream is nurtured. So make the most of this home away from home atmosphere. Thank you.
Okay. Thank you so much, sir, for your insightful guidance on student-centric facilities. Your word will surely help our students navigate and make the best use of all the opportunities provided by the university. Now, It's my honor to invite Dr. Prashant S., Dean of Academics, to address us. Sir will share his valuable insights on academic facilities, co-curricular, and extracurricular ecosystem at MGUG. So, good afternoon, everybody. It is a very proud moment to see all of you seated here with white coats and looking ahead of the days to come. And you're going to be here with us for 5.5 years. It must be a very proud moment for every parent who is seated at this part of the auditorium to see their ward, daughter, son, ready to become the future of India. So first, let us start this small talk of 5 minutes about the academic profile of the university by first giving our respect and gratitude to our parents. Can we have a good big round of applause, all those people? Thank you. And we assure you that the responsibility of making them as doctors and contributors for the growth of our nation will be ours. And to start with, thank you. To start with, we have got the right environment, the academic environment for all of you. The campus, which is spread across 200 plus acres, with multidisciplinary academic profile. In the health and the field of healthcare itself, we have got 4 faculties: Faculty of Medical Sciences, Faculty of Ayurveda, Faculty of Pharmaceutical Sciences, and Faculty of Nursing and Paramedical. That means the entire healthcare system portfolio is being offered as a single unit of service and education at Mahayogi Gorakhnath University, Gorakhpur. So that gives you an environment of holistic learning and teamwork. You are going to lead the team as a doctor, but every doctor requires a team of his own to make healthcare possible at the healthcare setup. So you have got the right equation at the university for your holistic education. That is where we start with. Not just stopping at academics or just clinical practice, we have got adjunct faculties like Faculty of Health and Life Sciences, which can be very useful for you, not just to become a doctor, but also be a doctor researcher in the days to come. You might have heard of India's growing startup ecosystem. Today, India is the 3rd largest ecosystem in the world. Now, what does it mean for you when you become doctors? That means you not only provide healthcare as a service, you also develop the healthcare as innovators. So for this, we have also got an Institution Innovation Council, which is going to help you to put your practical and theoretical knowledge into translational activity. You can be an inventor who could develop a medical device. You can be a person who coordinates with the pharmaceutical sciences and Ayurveda to develop a phytochemical medicine, to do research and innovation to not only develop the healthcare, but also develop the economic portfolio of the nation. So this is an opportunity beyond what you can see with just education, the academic profile of MGUG provides you with. Going further, if you take food as medicines, it will prevent you from taking medicines as food. Have you heard of this? And India is largely a country which has got a farmer base. So if you combine these 2 ends, we get Faculty of Agriculture. You as doctors can work out with having your own startup as a nutri company and a consultancy of your own as a doctor to bring health through nutrition. So that faculty also is there with us, the Faculty of Agriculture. So I have told you 4 faculties within the healthcare system: Faculty of Health and Life Sciences for your research and startup, Faculty of Agriculture for coordinated activity, and to manage all these things you need financial knowledge. So that also we have got as a Faculty of Commerce. So this, my dear ladies and gentlemen, is an academic profile of our university with 7 faculties spread across 200 plus acres of the campus. And you also have got certain things which are going to be very important for you for these coming 5.5 years. I have already told you about the Institution Innovation Council, but for your well-being, we also have got Internal Complaints Committee, ICC, which is going to be available for you as a part of the mentor-mentee scheme. Now, what is this mentor-mentee scheme within academics? Every group of students will be given one faculty who is going to take care of you, and you can feel connected with the faculty for every academic, curricular as well as extracurricular requirements of yours during your stay with us at MGUG. So this is also integrated into the academic portfolio of your 5.5 years program. Also, you can be free with gender equity, and there is a cell also to address the gender equity issues whenever there is a need. If you are an advanced learner, you will get opportunities to progress with many other fields of education, progress with self-directed learning, contribute to various other programs of the university. But if you feel time is taking toll, and if you feel you are a little bit of a slow learner, you can feel free to approach us for the slow learning mechanism support systems, which is going to be very helpful for you. And for this, we are also there is already existing a skeletal learning management system to control the academics and to make all these facilities available to you. In the days to come, the learning management system is working towards connecting you as well as the parents. So parents also will be able to track the progress of each of your students and wards through the learning management system. This is in the days to come. And for all these things, we have got lecture capture systems, enabled classrooms. We call it as hybrid classrooms, which you already might have seen. If not, you are going to be exposed to this in another foundational course when it is going to come over. And laboratories, museums, and all the facilities that is required for your education. But at the end of the day, it is not about how much resources you have. It is about how much of resources you utilize and come out with the outcomes. Now, whom is that dependent on? Excellent. So with that note, I end my talk of 5 minutes and I leave you to ponder upon central library facilities, laboratories, museums, classrooms, lecture capture systems, learning management systems, 12,000 seating capacity stadium, indoor games, outdoor games, equity cell, Institution Innovation Council, Internal Complaints Committee, cell for your progress. Anything more required for you for your academic growth? Everything available. All the best. Welcome to this family and rise and shine. Thank you.
Thank you, Dr. Prashant, for those enlightening words on academics and holistic development. Continuing further, it is my pleasure to invite Dr. Hariom Sharan, Dean of Information, Futuristic Technology and Strategic Planning, to address the students. Sir will speak on National Medical Council norms and guide our young doctors to the highest standards of medical education, practice, and ethics. So please.
Thank you very much. Good morning to everyone. As initially everyone said, and it gives me an immense pleasure to welcome you all. The second batch of MBBS 2025 at Sri Gorakshnath Medical College Hospital and Research Center, and their parents, my birthday colleagues. Today, as they mark the beginning of your journey into the noblest profession, that is medical education. As you step into this journey, so you have to know about your regulatory authorities and statutory body, what you have to follow, about your UG curriculum, which you have to follow, how you have to step out or step in your journey in this particular profession. After completion of your degree, you will become a doctor. So before that, during the journey, what we have to do, how we have to do, how we have to complete. So we have to know those things on this day. As today is the inauguration day of your foundation ceremony of your degree, which is circulated by the NMC, National Medical Council. So it's a statutory body governing medical education and practices in India. After the completion of your degree, you have to register yourself in NMC, in a state medical council, and as well as the Medical Council of India. So we have to know about the duration of the structure. Everyone knows about the structure or duration. But I have to explain about the things. Like your duration is 5.5 years, which includes 4.5 years is about the academic activities, with 1 year total intensive in the hospital. So your 4.5 years divided in 3 phases, as Dean Medical Sciences already said about it. In phase 1, having 12 months, you will learn about the understanding the human body. In phase 2, that is also having a 12 months. In this, you will learn how disease affects the body and how medicines works. Phase 3 is also divided in 2 parts, part 1 and part 2. As part 1 having also 12 months and part 2 having 18 months. After that, you have to complete your internship into the hospital, where you learn the skill, deploy your skill after the completion of your degree. So in this 2-week foundation course, which is started today onwards, you will learn about the BLS, you will learn about the communication technologies, as our Dean Academics of Mahayagi Goraknath University said about you have to indulge yourself in the technology, like he said about the IIC. But due to shortage of time, he didn't explain too much about that because we have a limited time about it. So you have to bring and learn about the time and stress management. This is also a part of our life and as well as your degree. Most important thing about attendance, assessment, and the examinations, and the detail about the examination, our control for examination, we'll discuss about it. But about the attendance, in theoretical attendance, minimum is 75%. It doesn't mean we have to complete up to 75%. It's a minimum rank. Like if you're having a minimum 75% attendance in theory part, it means you are eligible to appear into the examination. So आप ये मत भूलिएगा कि 75% बोला गया तो ये highest criteria. It is a lowest criteria into the academics, like in theory part. In clinical and practical, it is 80%. Minimum 80% attendance is required inside the hospitals and the laboratories. And during your internal assessment, like in phase 1, phase 2, phase 3, part 1, part 2, there will be a 3 internal assessment. So minimum 50%, you will get the 50% in your internal assessment, then you will be eligible to appear into the final university examination. So be serious about the internal assessment examination, which will be conducted by the principal and dean of medical college. So these are the things which you have to do. Support system as our Dean Student Welfare, he said, like our Honorable Vice Chancellor sir also said, we have prepared the Student Council. You just, whatever you have issues, you directly go to the Dean Students Welfare, Dr. Raghuram sir will be there. So regarding any type of issues regarding hostel superintendents are there, hostel wardens are there, and also in your academics, in your institution, mentors will be there. So they will support you. What you have don't, you cannot do inside the campus or outside the campus also. Please do not indulge into the ragging after completion of your phase 1. Avoid misuse of technical gadgets like mobile phone, tablets. Important thing for the medicos, do not record or post patient data or hospital incident on social platforms, any social platform, without the consent of any patient. We cannot do this thing. So do not neglect your mental and physical health. Seek support when needed through your mentors, through your faculty members, teachers, principals, deans. They are will be there. In the last, you are not just beginning a course. You are entering a lifetime commitment to humanity, as our Honorable Vice Chancellor sir said. उन्होंने एक इंसिडेंट अभी आपको शेयर किया था, लाइक एक दिन पहले का ही, उनकी डॉटर ने फील आउट किया. सो यू हैव टू फील योर प्रोफेशन. जब तक वो फील आपके अंदर नहीं होगा, यू कैन नॉट डिलीवर. डिलीवरी ऑफ हेल्थ केयर प्रोफेशनल्स, इट इज नॉट रिक्वायर्ड द प्लेस कि हम हॉस्पिटल में हैं तभी हम उस चीज को डिलीवर करेंगे. दिस इज द थिंग, बिकॉज ऑफ वी विल treat the human bodies, humans, lives. So we will work for the human mankind. So medicine is the science of experience and a profession of compassion. Let your journey make you not only a good doctor, but also a good human being. So congratulations once again, and best wishes for your journey ahead. Thank you very much. Thank you.
Thank you very much, sir, for sharing your valuable insights on National Medical Council norms. Your guidance will surely help our students to uphold the highest standards of medical education and professional ethics. Continuing further, it is my honor to invite Dr. Rohit Elani, sir, Medical Superintendent, to address the gathering. Sir will enlighten us about clinical training opportunities at MGUG and guide students on how to make the most of it. Please, sir.
Good afternoon, all. I congratulate all the proud parents and all the students, and I welcome them in Shri Gorakshnath Medical College as a second batch under MGUG Gorakshnath University. I am Medical Superintendent of Hospital under MGUG Gorakshnath University, Shri Gorakshnath Medical College. I'll just brief you about the hospital because almost everything has been covered by our Vice Chancellors, registrars, and everyone has told you almost everything about the courses and everything. I'll be just briefing you about the hospital. We have two functional hospitals in our college. One is Guru Gorakshnath Medical College, somewhere around 4.5 kilometers from this place. And we have MGUG Gorakshnath Hospital within this campus itself. I just assure you, in the coming time, you will see a very good facility in our campus itself. All the courses, every clinical teachings will happen in this hospital itself. Because from second year onwards, you will get posted in the clinical departments. From till first year, you will be basically in anatomy, physiology, biochem. 3 subjects you have to cover, and you will be in the college campus itself. Second year onwards, till final year or till your internship, you'll be part with us in the hospital. And in hospital, your patients is your best teacher. Patients will teach you everything. We will just be there to guide you. We'll help you out. And we'll try our level best so that you become a good clinician, good surgeons. Future mein PG kare. Do whatever you want to do, your specialty. You will decide what you want to do in the future. We are just there to help you out. Other than hospital part, other than academics part, extracurricular activities are very important. like sports activities, culture, inter competition, school, college competitions we have. We will organize everything. Any part of or any problems you face, you just come directly to me as well from the hospital point of view or from your academic point of view or any personal point of view. We are ready to help you out. Regarding the college campus, you can see it's a huge campus, fantastic campus according to the college, medical college. And anything else you want to ask us or anything, any help you want, we are ready to help you out. Thank you so much.
Thank you, sir, for your inspiring talk on clinical training and hands-on learning opportunities. Your insights will help our students to prepare well for practical aspects of their medical journey. Now, it's my pleasure to invite Shri Amit Kumar Singh, Controller of Examinations, to address the gathering. Sir will guide us on the examination and assessment system of the university. Please, sir.
Thank you. Good afternoon, respected dignitaries, esteemed faculty member, and dear parents, and my dear students. It gives me a great pleasure to welcome all of you to the MBBS Foundation Day program. You are beginning one of the most challenging and rewarding journey in the field of the medical education. As you started this journey, it is very important to understand the examination pattern and assessment criteria that will be guide your academic progress. Already Dr. Hariom Sharan sir speak about what is the time limit and what is the criteria and internal whatever. But apart from this, some things which are explained in the MBBS curriculum. Your performance will be assessed continuously through internal assessment, theory examination, and practical or clinical examinations. Each subject carries a combination of theory and practical oblique viva marks. Both are mixed up as per the curriculum and requirements. The internal assessment include your performance like periodic class test, assignments, practical or clinical works, and most important, attendance and overall discipline. तो आपका जो डिसिप्लिन होगा वो भी आपके क्राइटेरिया में आता है प्रैक्टिकल और इंटरनल असेसमेंट के मामले में. तो बी केयरफुल योर अटेंडेंस एंड डिसिप्लिन. चूंकि एग्जामिनेशन का जो क्राइटेरिया असेसमेंट का होता है ये एनएमसी के रूल्स पे होता है और हमारा जो एग्जामिनेशन जो होगा वो उस सेम नॉर्म्स को फॉलो करते हुए होता है. तो एग्जामिनेशन डिपार्टमेंट हमारा बहुत ही स्ट्रिक्ट है. अभी तक आपने अच्छी अच्छी बातें सुनी, बट एग्जामिनेशन डिपार्टमेंट का स्ट्रिक्ट होना इस वजह से भी हेल्पफुल होगा कि आपका जो आगे का ग्रोथ होगा वो डिसाइड करेगा कि आप डिसिप्लिन कैसे हो, आपका कैरिकुलम एक्टिविटीज कैसा है, आपका प्रोग्रेस कैसा है, कैसे क्या क्या करते हो. और इस सारी चीजों को अगर एग्जामिनेशन डिपार्टमेंट स्ट्रिक्ट है, स्ट्रिक्ट होगा तो ये आपका करियर और आगे के फ्यूचर के लिए ये होगा. तो जैसा डॉक्टर हरिओम सर ने पहले ही बोल दिया है कि अटेंडेंस इज कंपल्सरी टू 75% इन द थ्योरी एंड 80% इन प्रैक्टिकल एग्जामिनेशन. और ये फिक्स है. विदाउट अगर किसी का भी अटेंडेंस 75% से बिलो है इन एनी कंडीशन, इसमें मैं एक चीज क्लियर कर दूं कि ये नहीं कि ये मेडिकल में है तो मेडिकल के कुछ परसेंटेज ऐड हो जाए तो मेडिकल इंक्लूड होके. ये ऑल दीज क्राइटेरिया अपार्ट फ्रॉम दिस यू हैव टू सिक्योर 75% अटेंडेंस इन द थ्योरी एंड 80% अटेंडेंस इन द प्रैक्टिकल. बिलो दिस you are not going to allow the examination. This is the strictly, and I request the parents, they all are अपने स्टूडेंट्स को, अपने वार्ड को ये बताएं कि ये उनको अटेंड करना है. बाद में कभी होता है कि वो अटेंडेंस नहीं होता है, शॉर्ट नहीं, तो फिर बच्चे आते हैं, फिर पेरेंट्स भी आते हैं रिक्वेस्ट करने. तो ये इस प्लेटफॉर्म से ये पहले ही ये क्लियर इंस्ट्रक्शन है कि बिलो 75% अटेंडेंस और 85% जो क्राइटेरिया है होता है तो वो अलाउ नहीं होगा. तो दिस इज वेरी स्ट्रिक्टली एंड रिक्वेस्ट द स्टूडेंट्स to maintain the attendance. Okay, and internal assessment is your 100 marks. This is the theory parts and practical marks. To appear in the university exam, you have to secure the 50% marks aggregate. If you are failed to attend the 50% marks internal and well as external aggregate, you are not going to allow the university examination. So you have to prepare as accordingly to secure the 50% marks aggregate and separately 40% marks in theory and 40% marks in practical, but aggregate that will be 50% marks. If any students fail to gain these criteria, they are not going to allow the appear in the final examination. So this is also very important for you. And something related about the university examination. Suppose if you are not appear for the university examination, both theory and practical for a subject, any region, whatever, ऐसा ना हो कि कोई appear ना हो, but any region, then it shall not count as an attempt. आप में कैरिकुलम में attempt का वो है कि आपने कोई भी सब्जेक्ट या कोर्स कौन से अटेम्प्ट में पास किया है. आप अगर किसी अटेम्प्ट में किसी सब्जेक्ट में फेल हो जाते हो तो सिंपल वो नेक्स्ट में सप्लीमेंट्री जाएगा, वो आपका अटेम्प्ट आ जाएगा कि आपने इस अटेम्प्ट में फर्स्ट अटेम्प्ट सेकंड अटेम्प्ट में आप नहीं गया. तो हियर देयर आर रूल्स. इफ नॉट अपीयर फॉर द यूनिवर्सिटी एग्जामिनेशन बोथ इन थ्योरी, देन इट शैल नॉट बी काउंटेड एज एन अटेम्प्ट, बट पार्शियल अटेंडेंस इन द एग्जामिनेशन लाइक वन partial attendance in the examination, only theory or only practical in any subject shall be counted as an attempt. Like अगर आपने theory में attempt कर लिया, somehow आप practical attempt नहीं कर पाए, तो it will be counted as an attempt. Okay, no more than 4 attempts shall be allowed for a candidate to pass the phase 1 examination. जैसा अभी सबने बताया डीन सर ने कि दिस वन फेज 1, फेज 2 एंड फेज 3 2 पार्ट्स में होता है. फेज 3 पार्ट्स 1 एंड पार्ट्स 2. टाइमिंग ऑलरेडी है. तो मैक्सिमम जो फेज 1 जो पास आउट होने का टाइम लिमिट है दैट विल बी 4 इयर्स. अगर आप 4 इयर्स में फेज 1 कंप्लीट नहीं कर पाते हैं तो यू आर नॉट अलाउड अगेन. एंड टोटल पीरियड फॉर सक्सेसफुल कंप्लीशन ऑफ फेज 1 दैट वाज ऑलरेडी 4 इयर्स एंड शैल नॉट बी एंटाइटल्ड टू ग्रेजुएट लेटर देन 10 इयर्स. यानी आपका जो ये यूजी प्रोग्राम है एमबीबीएस का, ये टोटल जो टाइम लिमिट है पास आउट होने की 10 इयर्स है, इंक्लूडिंग योर इंटर्नशिप. इफ यू आर नॉट गेटिंग द पास अप विद इन दीज 10 इयर्स इंक्लूडिंग योर इंटर्नशिप, देन यू आर नॉट अलाउड टू मूव फर्दर. तो दिस इज द वेरी स्ट्रिक्ट अकॉर्डिंग टू एनएमसी गाइडलाइंस. And criteria for the passing in a subject. अगर आपने सब्जेक्ट में पास होने के लिए क्या चाहिए, if you are getting 40% marks in theory and 40% marks in practical separately, but agree you have to secure 50% marks. Then like if you are for example anatomy कोई सब्जेक्ट्स है, अगर आपने थ्योरी में 40 मार्क्स पा गए 40% एंड प्रैक्टिकल में भी आप 40% मार्क्स पाए, तो इंडिविजुअली तो आप पास हो गए उस सब्जेक्ट में, बट ओवरऑल यू आर फेल बिकॉज द पासिंग क्राइटेरिया ओवरऑल 50%. तो यू हैव टू स्कोर इन वन सब्जेक्ट एटलीस्ट मोर देन 60% या 50%. ओके, इन सब्जेक्ट दैट हैव पेपर्स minimum 40% marks in aggregate, both theory and practical. Supplementary examination requirement. Supplementary examination and declaration of results shall be processed by the university within the 6 to 8 weeks. अगर आपका कोई भी रेगुलर एग्जाम हुआ है, रेगुलर एग्जाम के रिजल्ट डिक्लेयर होने के विद इन 6 to 8 वीक में आपका सप्लीमेंट्री एग्जाम होगा, and the result will be declared. If you have again failed to clear your exam, then you have to continue with the junior batches. You are not promoted for the to the phase 2. अगर आपने सप्लीमेंट्री एग्जामिनेशन में भी क्लियर नहीं किया तो आपको कंटिन्यू करना पड़ेगा जूनियर बैच के साथ. आप सेकंड फेज में अलाउ नहीं हो सकते. तो दिस इज द वेरी क्लियर. If a student fell in the supplementary examination, there shall be no supplementary batches. आपको सप्लीमेंट्री करने के लिए आपको जूनियर बैच के साथ ही पढ़ना हो. कोई सप्लीमेंट्री बैच नहीं होती है. अलग से आपको कोई कुछ पढ़ाया नहीं जाएगा कि आप फेल हो चुके हो उसके लिए आपके पास कोई इसके लिए अलग से बैच नहीं होगा, क्योंकि ऑलरेडी नंबर ऑफ प्रोग्राम बैचेस वो चलते रहते हैं. तो these are the guidelines for the assessment regarding examination, and this is the very strict. तो स्टूडेंट्स एज वेल एज पेरेंट्स दोनों से ये हमारा रिक्वेस्ट है कि आप जो पेरेंट्स हैं वो अपने बच्चों को फोर्स कर अटेंडेंस रहें, डिसिप्लिन में रहें और रेगुलरली उनके इंटरनल जो मार्क्स हैं वो वॉच करते रहें. ये हमारे वेबसाइट से डीन प्रिंसिपल वो शो करते रहेंगे. नोटिस बोर्ड पे होगा, पेरेंट्स को भी जाएगा, मैसेज जाएगा कि ये वॉचिंग करते रहें कि उनके ये है. क्योंकि ऐसा नहीं है कि इंटरनल असेसमेंट में बच्चा क्या है डायरेक्ट वो यूनिवर्सिटी एग्जाम दे सकता है. ऐसा नहीं. अगर वो 50% मार्क्स नहीं पाया है फिर वो यूनिवर्सिटी एग्जाम नहीं दे पाएगा. ओके, फॉर दिस वर्ड थैंक यू वेरी मच.
Thank you very much, sir, for your insightful words on examination and assessment system. Your guidance will surely help our students understand the academic expectations at MGUG. Now, it's my honor to invite the heads of the core first-year departments to address the new batch and share their wisdom on their respective subjects. First, I would like to invite Dr. Varsha Mukshai, ma'am, the head of department and anatomy, to address the students. Ma'am, please.
Thank you. Good afternoon, everyone. Respected dignitaries, my colleagues, parents, proud parents, and dear students. I welcome you all to this long journey of MBBS. It's 5.5 years. Yes, no doubt, थकान हो जाता है बीच में. You have to pull up yourself and then gear up and then start studying. It's very interesting. Any learning, if you take it to your stride, it's a journey to look forward. And then in anatomy, it's what you're studying is the geography of the body, where what is. So when a patient comes to you, he comes with skin, bone, everything inside, and then he is with full of emotions also. And then you need to put your hand on him or her and then see what lies beneath your palm when you're palpating, when you're touching the patient. So that is what you're going to learn in anatomy. All of them said 75%, 80% attendance, and I don't believe in that. I want my children to have 100% attendance. Will you assure me? Yeah. Our target is 100. If in any case, any untoward happening, 80% or 75, that is fine. But otherwise, 100% attendance definitely will take you to exams will be just walk through. You don't have to think of supplementary. You don't have to think of the another attempt, because that is what is required for us. Every day, if you miss one day, the continuity is missed. And second day and third day, what happens is you will get used to that laziness. And then catching up again and then studying is not that easy. So please have it in mind as much as possible. Don't miss any class. And parents, I tell you, all these, we have plenty of festivals in our India. Please don't call them for all the festivals. Whatever university stipulated holidays are there, please take them for that. And then let them not be staying away from the learning, especially first year. If it is taken as tapasya, you will catch the grip, or you will get into the grip of like how to study, what to do, because you're just transitioning from your MCQ based learning what you had in 10th, PU1, PU2, entrance, all these were multiple choice things were there, and then only competitive exams you prepared more. So now it is the understanding, conceptual learning is there. So if you miss out the attendance part of it, definitely it's going to affect your learning. Please keep it in mind and let it be engraved in your mind. And okay, to have this science education, you need four C's. One is curiosity. For any science subject, curiosity is very much important. Then commitment should be there to overcome that curiosity. Why this is happening, where it is happening. I need to commit myself to learn all these things. So that is second one. And then third one is consistency. Yeah, today I'll not read. Tomorrow I'll read. Why I should read every day? So much of studies. Yes, no doubt, MBBS is voluminous, but it's fun. I tell you, it's fun to learn. Any day, every day, something. Even now, we are learning at this age and stage of our life also. So, learning, as long as we are doing that, the enthusiasm doesn't stop. So, that is the third C. After all this, you become a doctor and you need to have a compassion. I don't want my students to, if somebody is fallen or something, take a mobile and take their picture and then put it on this thing or share it. No, I want them to go to them and then help them with the compassion, what needs to be done. That is what is a doctor as a human being. That should be, please, kept in your mind. And then don't do, if somebody else is doing also, you are supposed to be, you should be the brand ambassador to stop that kind of a culture of taking the videographing the accident scenarios or any of this one. If somebody is in some situation and all that, as doctors, we have that responsibility to change the society. Please think it, keep it in your mind. And after all this, you need to have the best quality of any human being is gratitude. Be thankful to your parents for putting you here in a medical college with all their efforts, prayers, and everything. Give them, like how sir said, give them one big round of applause, thanking them for you to be here. And then second is, yeah, the society is making you doctor, and your teachers who are shaping you from your nursery, LKG, UKG till here, they have brought you your teachers. So great gratitude for them also. And then the more your heart is full of gratitude, you will be welcome. So there is a Sanskrit shloka, I don't remember fully. Doctors and teachers, the Vaidya Upadhyaya Vishayante Aprayojakaha. Something is there in between, I'm not able to recollect. Vishayante Aprayojakaha means doctor should treat so well, the patient should not come back for that disease. The teacher should teach so well that students should not come back or fail and stay there. So that is, so we being both doctors and teachers, our responsibility is double, and we want you to move ahead with stethoscope and big names and big degrees, and finally a successful doctors with humane qualities towards the society. Welcome you all. Thank you.
Thank you very much, ma'am, for your enlightening words on anatomy and guidance for the students. Next, I'm pleased to invite Dr. K.I. King, Head of Department of Physiology, to address the students.
Respected faculty members, proud parents, and my dear students. Congratulations to all the students and a warm welcome to Mahayogi Gorakhnath Medical College, Hospital and Research Center. Medicine is a noble art and calling. It is not a business. It is not a job. It's a calling. It's an art. And you have come here to study it. In order to achieve the competencies required to meet and become a doctor, you need few C's. Character, which is the foundation for all other qualities. You need competence, which we will be teaching you Here you become competent enough to become a doctor. You need commitment and discipline, which is also essential in order to become a doctor. And as Madam said, you need compassion. Compassion for the patients is the absolute essential quality of a doctor. So you should be compassionate and you should have communication skills, which we will also be teaching. We have something called ATCOM, Attitude, Ethics and Communication, which will be as a part of the curriculum that we'll be teaching. And communication is important because you need to communicate to the patients, not only to the patients, but also to the patients' attenders. Your communication skill is a very important attribute of being a doctor. And there are some challenges in medicine, as you know. It's very challenging because of the vast amount of information that is out there in the various subjects. So at times you will feel that I'm not good, I'm not up to the mark. It's a common thing that happens. What is important here is you need perseverance, or you need to stick and commit yourself to study so that this vast amount of information does not overwhelm you, for which you need commitment and discipline. Another important thing is please take care of your physical as well as mental health. Both of them are absolutely essential. If you don't take care of your health, you will not be able to take care of the patient's health. So please take care of your physical and mental health. Please involve yourself in extracurricular activities like sports, singing, so on and so forth. And another important thing is all of you are going to become a doctor and you will be an inspiration to the society. What you are doing is humanitarian service. Especially we saw that during the COVID pandemic, there was COVID-19. That was when we doctors, we suddenly became warriors. It's only when the enemy is at the gate, everybody remembers the warrior. So we were the warriors and we were at the forefront in fighting COVID. So you have a responsibility as a doctor and you will be fighting these diseases and you will be at the forefront in doing humanitarian service. As the saying goes, Matrudevo Bhava, Pitrudevo Bhava, Acharya Devo Bhava. Mother is God, father is God, and the teacher is God. All you students, you have sweated it out to reach here and sit here. But more importantly, please don't forget your parents. They have shed blood, sweat, tears, and sacrifice to make you a doctor. So now you are known as son so and so, you are known as daughter of so and so. But you should reach that level and you should achieve that standard wherein tomorrow when they show your father or when they show your mother, they should say, he is the father of Dr. So and so. She is the mother of Dr. So and so. Your parents have put a lot of effort in bringing you here. So I am absolutely confident that you will achieve it and make your parents proud and you will make Mahayogi Gorakhnath Medical College proud and you will bring glory to our institution. So fasten your seatbelts and enjoy the flight of medical education. Jai Hind, Jai Uttar Pradesh.
As quoted by William Shakespeare, better 3 hours too soon than a minute too late. Thank you for your guidance, sir. Now it's my pleasure to invite Dr. Tejaswini Mopala, Head of Department of Biochemistry, to address the students. Ma'am, we warmly welcome you to the stage.
Good afternoon to one and all present here. I am Dr. Tejaswini, Professor and HOD of Biochemistry. First of all, I would like to congratulate all of you for joining the MBBS course. And also I welcome you to Sri Gorakshanath Medical College. Biochemistry, in a single sentence, I would say it as it's the chemical foundation of life. So biochemistry deals with biomolecules which are composing the structure and which are responsible for the daily function and your normal metabolism. In case if there is alteration of these biomolecules, it would result in the disease. And if you get the disease, how is a doctor going to diagnose it? By ordering investigations. So the investigations of biochemistry, from simple your blood glucose estimation, cholesterol, to advanced testing of tumor markers and genetic testing. These days, as you all know, we are in an era of genomics and personalized medicine. So biochemistry, it has a very close applications in this field. So we, the faculty of biochemistry, would help you learn all these concepts. Only thing, you be regular, be disciplined, and follow time management. Throughout the next week, 2 weeks, in the foundation course, we'll be teaching you about time management and different study techniques. So please learn them and use them. Okay, all the best.
Thank you, ma'am, for your words on and guidance on biochemistry. Your advice will surely help our students navigate their academic journey with confidence and dedication. As we conclude this beautiful and memorable ceremony, I extend my heartfelt gratitude to all the respected parents, faculty members, dignitaries, and the audience present here. Your presence and support have made this day truly special for our new MBBS batch. Now, I request everyone, students, parents, and guests, to kindly proceed for lunch. Okay. So our dean sir would love to talk to you for a few minutes. Sir.
Our controller of examination, Amit sir, has scared you. It is his duty. Don't scare. Don't get scared. Because he has to be strict. Otherwise, you will take examination cell as, yeah, we can pass. But what you got? All the three HODs of first phase one, what was their thing? What did they communicate it to you? Madam told nicely, it's not that above the whatever the level which our COE has kept. Madam told 100%. I agree Madam's statement. Because here in medicine, what will happen? There is a link between, and biochemistry Madam neatly told that, there is a link between each subject. You are learning the macroscopic and microscopic structure of the human body in anatomy. You are learning the structure, functions of the human body, how it is working in physiology, and biochemistry, as Madam rightly told, how the chemicals contribute for all these functions. It's a beautiful, it has been explained in our Chaturveda, all the Vedas, it has been given. That we are studying with the modern medicine. So with all our experienced teachers, it will not be difficult. You plan your study rather than maintain, like thinking of attending only 75% or 80% classes. Try to come as much as possible until unless you have a genuine reason that you are not feeling well. And I also mentioned, and physiology HOD King sir also mentioned, it is very true that you have to maintain your physical and mental health. For that, involve in your extracurricular activities, and if you have developed any music or any other hobbies, continue with that. We are all with you. It's not necessary to scare that. It's very difficult to pass MBBS. It's very easy to pass. Listen to your teachers. Listen to their guidance. Follow their guidelines. That's it. Nothing more than that. Okay? Are you happy? and also keep what sir has told in mind, because you should not become not eligible, that we should give any chance for him to become make us not eligible. Aina? Is it? Will you all accept? Okay, give him a big hand, like, so that. Thank you all. Thank you all. Probably we are all proceeding for lunch, like our students are going to announce.
So, on behalf of myself, Shrijan Suryavanshi, and my co-host,
Rashi Singh,
we sign off from this ceremony with our warmest wishes for the bright and successful future of the MBBS batch of 2025-2026. Thank you and have a wonderful day ahead. And please note, for lunch, all the parents, girl students, and all the faculty members will move towards the lobby of the auditorium. And all the boys are requested to move to the boys' hostel mess. Thank you.